All right, guys. So the next PowerPoint that we got for you guys is all about addiction. Okay. So addiction is going to be, it's also known as drug dependence. So you can be addicted to a drug or dependent on that drug. Either way, that's synonymous. And it's a disorder characterized by a pathological desire for drugs. So even if you want to stop, it is very difficult to do so. That is what addiction is. So, oftentimes we think of, why don't people just stop using these drugs? Well, there are actual physiological changes in the brain that make it incredibly difficult for people to stop doing what they're addicted to doing. And this affects about 9% of Americans, and the cost is over $600 billion a year. So keep in mind that, we as humans, we have things that we enjoy doing, right? So for example, some people like specific types of food, some specific types of desserts, maybe some of us like to play a sport or an instrument and things like that. And when we get good at it, or when we get the stimulus of doing that action, we actually get rewarded. This is also exactly the same as when we get hungry. When we actually obtain and consume food, we feel better, we feel happy. There's a reward system in our brain that governs that. Now, when it comes to addiction, that reward pathway is kind of enhanced or obscured by the drug. So whatever drug we're talking about, many drugs often mimic neurotransmitters, and oftentimes they also block neurotransmitters. It just depends on the drug. And so imagine the dopaminergic pathway, where the reward system in the basal ganglia was affected via some other type of drug. Now your body downregulates whatever neurotransmitter it was producing in order to obtain that reward. If you stop using that drug now, your body will start to crave that thing that it was that you only got from the drug, because your body no longer produces said thing. There's other kind of similar concepts. For example, testosterone. If a bodybuilder wants to get as big as Arnold Schwarzenegger back in the day, or any other top level bodybuilder, there is the use of illegal steroids, which are testosterone. The problem with that is that once you start using these drugs, your body will stop producing its natural supply of whatever hormone or neurotransmitter it's mimicking. In this case, testosterone as an exogenous steroid will stop the production of testosterone in the testes of the male. This is why one of the symptoms would be shrinking of the testes for that user. Same idea if you have a drug that mimics a neurotransmitter that your brain produces or some part of your body produces. Once you start getting that neurotransmitter effect from an exogenous source, your body will naturally decrease the production of that neurotransmitter, and you will become dependent on that drug. And it's very difficult to get away from that. Now, the brain reward system is basically a circuit of neurons in the brain which is important for learning, and it's evolved to give us pleasure and motivation to do certain things. So without those neurotransmitters, we wouldn't learn as well. We wouldn't be motivated to do anything like hunt or gather or produce things, maybe motivation to do your homework, etc. And these can be activated by these drugs. So when treating certain drug addictions, you want to target this reward pathway. So on this slide, we see a couple of factors that can lead to addiction and contribute to addiction. So this often depends on the motive of the person behind the drug use. So for example, people that take them to get the high are more susceptible to being addicted than people who take them for pain relief. That's not to say that pain relieving drugs are not addictive, because we're in the middle of that opioid crisis. So these drugs that help us relieve pain can also become addicting, and that'll be contributed via some of these other factors. So genetic susceptibility and environmental factors. So your genetics play a huge role in pretty much everything, in terms of your tolerance to certain drugs or tolerance to certain chemicals, as well as your height, your weight. All these things are applied to genetics. So obviously genetics will also play a role in addiction. But there's also other environmental factors that come to mind that could affect the leading of addiction. One of those is stress. There are also other environmental factors regarding everyday life that could lead to stress becoming very high, which would lead to more susceptibility to becoming addicted. Then there's also the characteristics of the drugs. This is a chemical standpoint of how quickly they can enter the brain. So if you recall, most of the blood vessels that will deliver blood to the brain, there's actually a blood-brain barrier. So hopefully you guys have all heard of the BBB, or the blood-brain barrier. And it's a very, very low tolerance, low permeability membrane that only allows certain things to pass through. So certain drugs can get through. For example, alcohol can easily pass through. Ecstasy and other drugs can easily pass through. And this is what creates the high. It could also lead to hallucinations. It could also lead to feeling very happy and rewarded. The next thing would be a person's tolerance. And this actually depends over time and time of use and concentration of use. So the progressive need for higher and higher doses to achieve the same effect. So for example, this can be easily explained with alcohol, just because it's such a readily available drug. A person who drinks more regularly will have a higher tolerance, which means that they're going to have to consume more alcohol in order to feel the effects of alcohol. Whereas someone who doesn't drink ever, if they start to consume a little bit of alcohol here and there, their susceptibility to it is much greater, and therefore they will feel the effects much sooner and with a lower concentration. And then finally there's dependence. So dependence is just the adaptive physiological state that results in withdrawal symptoms when a drug is stopped. So hopefully none of you guys have started drinking caffeine just yet. I know if you're Hispanic like me, you've probably started drinking coffee at a very young age because of your parents. But caffeine is actually a drug. And dependence is actually very well shown in caffeine. It's a really easy example to use just because it's so widely used. So once a person starts getting accustomed to drinking caffeine, whether it be through coffee or an energy drink, or whatever it may be, if you just immediately stop drinking caffeine, you will, within the next 24 to 48 hours, you will have withdrawals of caffeine. So you'll usually experience headaches, tiredness, things like that. And that usually will lead to you grabbing more caffeine. And so it's very hard to give up caffeine. And caffeine addiction, although is not as super serious, is a very commonplace thing that occurs in the developed world, in the United States especially. And if you're a college student like me, then yeah, the addiction's real. So caffeine is something that many people are dependent on, and the dosage will determine the physiological effects. So here are some statistics for you guys in terms of nicotine. So nicotine is a drug that is present in cigarettes, as well as some other substances, but in this case we're talking about tobacco. And tobacco kills more than 440,000 people per year in the United States, which is more than alcohol, more than cocaine, more than heroin, more than homicide, suicide, and even car accidents, and HIV combined. Although HIV is definitely one of those that's getting smaller and smaller, thanks to relevant and modern research. And it's the leading preventable cause of death in the United States. So, in this case, nicotine and tobacco can produce so many other cancers and so many other diseases and things like that, it's a completely preventable thing. You don't have to consume it, and if you have the option to not take any, then by all means please choose to not take any. The overall cost of smoking is $193 billion. So kind of a thought question for you guys, is something that I've thought about all the time, is if we know a drug can be incredibly addicting even if it's taken once, in this case we're talking about nicotine, how at all is that legal? Because it's kind of like you're taking advantage of humans, the physiological state of humans, in order to sell your product. If tobacco was sold on its own, without nicotine-less tobacco, the addiction would be less and those industries would make significantly less money. But they make most of their money from creating addiction in humans, which arguably is a form of physiological slavery, and I'm not really sure how that is relevant and legal today. But it is something that we're dealing with, and luckily smoking numbers have decreased significantly in the last couple of decades. So if someone that smokes, help them out and try to get them to let go of those cigarettes and tobacco usage, little by little. You got to be really understanding, because again, these physiological changes that these drugs induce in a person's brain they're very hard to get over, and it takes a significant amount of time and habit building to let go of these addictions, especially when it comes to smoking. So here we can take a look at a basic mechanism that makes nicotine addictive. So nicotine can be a stimulant, and it can also be a sedative. So meaning that it can get you really happy and excited, but it can also kind of relax you. So it kind of depends on the modulation of it. But in this case, it's going to act through the acetylcholine nicotinic receptor, and it's going to stimulate the adrenal glands. This leads to a discharge of epinephrine. So hopefully the word epinephrine rings a bell to you guys, which will lead to an increased amount of glucose in the blood, blood pressure, heart rate, and respiration. So in this case, adrenaline is flowing and the person is excited. It kind of has a similar effect to what caffeine would have, where you're more focused, there's more glucose in your blood for your organs to use, your metabolism can increase a little bit. It also releases dopamine in the brain regions that control motivation. And this is why people get addicted, because once you light up a cigarette and take a couple puffs, it's very quick for that nicotine to get into the brain and then release dopamine, which will get you to feel like you've been rewarded, like you've accomplished something. It'll make you happy. And this is why these drugs can get addicting. So the next question is, how do we treat people who have nicotine addictions, and how do we get them to a better, more sustainable lifestyle? You can't just, stop smoking. There are very really, headstrong people that can probably do that, but it is very difficult, and it isn't exactly easy, satisfying, and it definitely affects your everyday life. So for most people, cutting out cigarettes as soon as possible just isn't a sustainable methodology for reducing addiction. As a personal trainer, I see this with diet all the time. People who have created this habit, even if it isn't addicting, those habits that you do every single day are incredibly difficult to break. And if you don't introduce a method of sustainability and longevity into a person's diet plan, similarly as you would apply it into a person's nicotine addiction treatment plan, their withdrawal is going to be more significant. They're going to relapse back into whatever they were doing, and they're not going to see the gains and the progress that they want to make. So there's a lot of similarities here in that idea. So some things that we can use are nicotine supplements. So for example, gum that contains nicotine. Many of you have probably heard of the patches. There's also nasal spray and some types of inhalers. These supplements have less nicotine than the cigarettes, but they're just enough so that the person can feel satisfied and get some less severe physiological effects. And so it'll also eliminate the smoking portion of this, which means that the person's lungs are going to be saved. There's a less risk of cancer, better physical fitness, and things like this. Similarly, we can use other medications as those that are listed above. These include antidepressants and other drugs that interact directly with acetylcholine nicotinic receptors, which can prevent the nicotine from activating the circuit. So we can use our knowledge of the brain's physiology to counteract nicotine and hopefully take the addiction away from the drug that is the smoking of the cigarette into something else that's less harmful, at least for a short period of time, while we decrease the dosage over time. And there's also, behavioral treatments, which is learning coping skills, which is important for relapse prevention. So this is like cognitive behavioral therapy, where we're practicing good habits or teaching better habits and trying to destroy the old habits that were getting us addicted into these things in the first place. So here's some statistics for alcohol, which is a little bit different than nicotine, but you can still get addicted to alcohol. So alcohol affects 17.6 million people. So that number of people have abused or are addicted to alcohol. And the overall cost of this abuse is about $185 billion a year. The worst part about alcohol is that, one, it's just so readily obtainable, but two, it can also lead to things like fetal alcohol syndrome. So most cases of death from alcohol are actually indirect. So for example, drunk driving or misusing equipment or misusing firearms while drunk and things like this. It's not always, alcohol poisoning, although those do occur. But the worst thing is probably fetal alcohol syndrome, where a pregnant woman will, have one too many drinks while pregnant, and this can affect, 1 to 3 out of every 1,000 newborns in the United States. Which is way too high for such a developed country like the United States. And it's one of the leading preventable causes of mental retardation in the United States. So fetal alcohol syndrome has a couple of physical effects, but one of the main ones is that it's going to affect the development of the nervous system. And so a child with fetal alcohol syndrome will unfortunately have learning disabilities and probably not adapt to their environment the same way. And it's a very difficult situation. And again, it's completely preventable. If you know you're pregnant, then don't drink alcohol. It's really that simple. But it is unfortunate that we have to discuss this. So because alcohol can actually pass some of the tightest membranes in our body, for example, the blood-brain barrier, it can also pass through the placenta, which is why drinking alcohol will also get transferred into the baby and have negative physiological effects on the fetus developing. So here's some of the mechanisms that alcohol abuse can actually lead to. So liver cirrhosis is probably one of the bigger ones. So liver cirrhosis is basically failure of the liver. There's a couple ways that you can cause liver cirrhosis. One of them is hepatitis, but the other would be chronic alcohol abuse. So many of you probably know that if you cut a piece of your liver out, it'll actually regenerate. But when it comes to liver cirrhosis, there's so much damage to the cells of the liver that it won't actually ever get better. So once you actually cause liver cirrhosis in your body, there is never anything that we can do, at least yet, maybe with stem cells, but we can't undo it. The only thing that we can do is stop further damage from being done to the liver. So ethanol. So ethanol is the active ingredient in the alcoholic beverage. So in low doses, it's actually a stimulant, so you can actually feel good. So many people who, you may have heard it be called liquid courage, for example. So if you're ever scared of something, people would often take like a shot of some type of alcohol to gain a little bit of courage. That's where the name came from. People often associate a little bit of alcohol with just getting loose, so that there's less fear, there's less thinking about what's about to happen. So in that case, it would be a stimulant. However, once you consume too much of it, it becomes a depressant, meaning that you could get lower in energy, you could get depressive thoughts, literally, and you can just feel very low, like just bad. And too much can actually lead to heat loss and dehydration. So the biggest thing, especially coming from a personal trainer, whenever you're consuming alcohol, the amount of metabolism in terms of glucose metabolism and lipolysis and things like this is actually decreased significantly when there is alcohol present. So the consumption of alcohol will actually decrease your body's ability to break down the needed nutrients that your body needs. So whenever you're, for example, if I'm training a client and my client asks me, can I have like a drink at the bar after this? My usual answer is yes. You shouldn't just restrict a person's ability to drink or have like a dessert here and there. The problem though is when you're destroying your muscles in the gym, when you're breaking down muscles, the whole purpose of making gains or building muscle or gaining performance is to recover. And recovery requires your body to break down proteins into amino acids, and amino acids eventually building blocks for the proteins that is your muscle. Alcohol will significantly limit that potential by taking your body's metabolism away from glucose and then instead moving it to, so from glucose and amino acids and fatty acids to moving it to alcohol. And so alcohol will limit recovery, and so people will often be incredibly sore the next day if they overdrink their alcohol. One of the reasons that this happens is because ethanol is actually a diuretic, so it'll actually dehydrate you. This is why when people drink alcohol, they often need to pee very soon after drinking it. Your body basically reduces the amount of water in the system. There's a bunch of properties of liquids and pressure and things like that and concentration that leads you to lose water, and then you pee it out. And the problem with this is that if you're dehydrated, your metabolism slows down, your muscles cramp up. When it comes to physical fitness and performance, this would obviously be a bad thing. Now, interestingly, there is actually a potential plus side to this, but it is arguably a little dangerous. But just as a little fun fact for you guys, many bodybuilders or fitness models may drink things like caffeine or alcohol the night before a photo shoot, for example. The reason for that is that if your muscles and your body has less liquids in it, you get this drier, sharper look in the image. So it looks like you're less flabby. Even though these people are at a very low body fat percentage, losing that extra bit of water will actually make them look quote unquote tighter. And so I know of many of my friends who prep for a bodybuilding show and have taken a couple drinks the night before just to look a little tight on stage and things like this. But again, that is dangerous because you're dehydrating yourself. There's less electrolytes in your system. The severe case of this would be severe dehydration and electrolyte loss to the point that you're getting brain damage. And of course, too much alcohol can actually lead to brain damage. So you definitely don't want to overdo that. But that is something that some people do in the field of bodybuilding and fitness. So what's the mechanism behind alcohol? So alcohol can lead to GABA oversecretion. And GABA is the main inhibitory neurotransmitter in the brain. So hopefully you guys remember that from the neurotransmitter section. And oversecretion can actually calm anxiety, but it can also, like I said before, impair muscle movement. And this has to do with the dehydration factor as well as some other reasons. So if you're dehydrated and your electrolytes are being secreted via urine, you're not going to be performing optimally. And this is how people get cramps. This is how people get fatigued, potentially muscle strains and things like that. This is also one of the reasons why reaction time is delayed. So if your muscles don't have as much glucose, as much water, and as much electrolytes, they're not going to be able to react as quickly. So from a performance standpoint, as a personal trainer, if you want to perform at your very best, your muscles should have some sort of glycogen in your system, and you should be very well hydrated. In fact, if you're dehydrated, you can decrease performance by as much as 20%, even if you're just slightly dehydrated. So that's nothing that you ever really want to do. At higher doses of alcohol, it can actually decrease the function of the NMDA receptors. The NMDA receptors recognize glutamate, which again, glutamate is one of the most prevalent neurotransmitters in the mammalian nervous system. Now, alcohol can actually activate the endogenous opioid system, which gives euphoria from your own endorphins when you're drinking, which is why alcohol can cause you to feel really good. Now, another thing that is relevant in this discussion is, for example, drunk driving. So drunk driving is a no-go 100% of the time. So if you know someone that does it or have ever get into the position of potentially doing it, always no. Do not do it, because literally after doing this discussion, you should know that alcohol is going to impair your judgment. Alcohol is going to impair your reaction time and your muscle activity. And none of that will lead to any positive results. But the second thing is that alcohol will actually get you to be a little dizzy. Many of you have probably know this from maybe watching movies and things like that. And so when a police officer stops someone for drunk driving, they perform something called the Romberg's test. Romberg's test is basically where the person stands with their feet together, but with their eyes closed. So if you try this right now, stand up straight with your feet together, close your eyes, and try to maintain your balance. In a normal human, this isn't very difficult because of our vestibular system. We're pretty good at it. But in a person who is intoxicated with alcohol, the liquid that is within their vestibular system, the perilymph and the endolymph, things like this, in the vestibular system within their ear, their inner ear, that liquid becomes less viscous, which means it becomes thinner. It gets thinned out. And in that system, we have tiny little hair-like cells that are stimulated via the movement of this liquid. And so when the liquid gets less viscous, the hair cells are overstimulated, causing us to feel dizzy and like we're moving a lot. This can lead to vertigo and things like this. And overconsumption of alcohol to the point that you're passing out can actually lead to a coma. So we currently live in a society that, movie after movie and show after show, and for some reason we put partying and over drinking on the spotlight in terms of the Hollywood system, and blacking out, it seems to be like something that is an achievement in a person's lifetime. Well, it really shouldn't be, and I hope you guys think twice before doing it yourselves, just because it can lead to a lot of very negative things, including coma and possibly death. So think twice before you overdrink, please. So I apologize if I made that a little bit, of a depressing lesson, but it is relevant to talk about, and I hope you guys take that home with you guys today. But let's talk about the treatment of alcohol. So this drug, naltrexone, originally developed for heroin addiction, works by blocking the opioid receptors. And this was approved in 1995 by the FDA for the treatment of alcoholism. So here we see a drug overlapping in its use. There's actually a lot of overlap when it comes to neuroscience in terms of drug use. So we've actually seen antidepressant drugs used to treat epilepsy and vice versa. And there's just a lot of overlap of drugs that we didn't really think would have effects in certain diseases, but fortunately they do. So please memorize this and have this one in the back of your mind because it might be a question later on. So the next one is marijuana. Now this one's currently a little bit debatable whether or not you can get addicted to marijuana or if it is addicting in the same way. But we are going to talk about its active ingredient and its physiological effects. So the active ingredient is THC, so tetrahydrocannabinol. So THC is the main active ingredient that's actually going to cause the effects of marijuana. And those effects are distortion of perception, altering the sense of time, space, and even self. And these things can produce anxiety and things like that. But let's talk about more about its actual mechanism. So the mechanism behind marijuana. So THC is going to bind to the cannabinoid receptors in our brain. These cannabinoid receptors help coordinate movement, which is how we can explain that marijuana usage can actually impair driving after smoking. And some of these receptors are found inside of the hippocampus. And you guys already know what the hippocampus is responsible for because we just did memory learning and things like that. But it's involved in memory storage and in learning. So this is how we can explain that marijuana usage can lead to poor short-term memory and problems processing complex information. This is why a person who might be high on marijuana can seem a little slow. And then they normally bind to the natural chemicals called endocannabinoids. So an example would be anandamide. So please know that marijuana can potentially affect the hippocampus as well as the parts of our brain that help coordinate movement. Now, opiates in general. So humans have been using opiates for thousands of years. Monkeys and rats will actually readily self-administer heroin or morphine and become dependent on it. So we've studied these effects on these types of mammals, and we can tell how they're addictive. And then some of the withdrawal symptoms, they can range from mild flu-like symptoms to severe muscle pain, stomach cramps, diarrhea, and mood changes. Mood changes would be the obvious one, right? Because when you're not getting something you want, depression, anger, fear, those kinds of emotions tend to get stirred up. So opiates as a mechanism, so they increase the amount of dopamine released in the brain's reward system. So dopamine is one of those major neurotransmitters that not only helps us in movement, but also in the reward system. Heroin, for example, if you inject it into a vein, can enter the brain in as little as 15 seconds. And this is going to bind to the opiate receptors found in a bunch of the regions in the brain, which includes the reward system. And in small doses, these opiates can actually have some beneficial effects, which is arguably counteracted by their addictive effects. But they can relieve pain, which is one of the more common forms of opiate prescription. They can depress breathing. They can cause vomiting and stop diarrhea. But in larger doses, not only are they potentially addicting, but they can actually cause death. And this gets me to a very important general concept, and that is the dosage of a drug or a chemical is one of the most important things to consider. So the dosage, for example, you can drink too much water. Water is something that we need in our everyday lives, but if we drink way too much, we could also die. Now that too much water is a very difficult amount to drink on a daily basis anyway, but it is possible and it has happened. And so keep in mind that dosage is one of the most important concepts when it comes to the LD50 or chemical tolerance in the human body. So here's some of the treatments that we can use for opiate addiction. So methadone is one. This is a long-acting oral opioid that keeps cravings and withdrawals away. And the main function of this is to make sure that withdrawal symptoms are lessened, which will make staying away from the addiction a lot easier. Then we have naloxone and naltrexone. I would recommend looking more into these drugs on your own time, but these are antagonists for opioid receptors. So if you take this drug, even if you take the drug that you're addicted to, there will be no physiological effects, and therefore you won't feel the need to continue using it because it's not working in the same way that it was, just because we blocked the receptor. So psychostimulants include cocaine and amphetamines. This will greatly elevate dopamine levels in specific areas of the brain, which would include the nucleus accumbens. And it's thought to result in a progressively increasing motivation to take the drugs. So basically, the more you take it, the more you want to take it, which is an obvious pathway to addiction, right? And binges can usually lead to a crash afterwards. So basically, the shutdown of dopamine and serotonin function. There's a little concept in biochemistry where if a receptor is continuously used, the effectiveness of that stimulus will actually decrease over time. This happens in things like diabetes, for example, and type 2 diabetes. And in this case, when the drug just continuously attacks these receptors, or maybe not attack, but stimulates the receptors, the effect of the normal neurotransmitters on that receptors will be lessened. Now let's talk about some club drugs. So some examples of club drugs would include ecstasy, roofies, GHB, and ketamine. Now, these are usually often used by teens and young adults at raves and trances and all these dance festivals and things like that. And it's been uncovered that these drugs can cause serious damage to parts of the brain, to the point that, if you damage certain parts of the brain, the neurogenesis in teens and young adults will be very limited. And so this can be very debilitating. So ecstasy, which is also known as MDMA or XTC, is a synthetic psychoactive drug that will cause the person to hallucinate. So it has hallucinogenic properties. Chronic use can lead to long-term changes in parts of the brain, which are critical for thought, memory, and pleasure. So essentially, the more you use this drug, the more you kind of go insane. The less you can think, the less you can remember, and the less you enjoy life as a whole. And so ecstasy is a very powerful drug. And actually, when it comes to neuroscience, there's a huge new field now that is microdosing drugs like ecstasy to see if there's any beneficial effects of it in mammals at very, very low concentrations. So this is kind of a new and eye-opening field that was only a few decades ago, or really only a couple of years ago, was illegal to do scientific testing on. So we'll see what that actually comes out with in the future. So furthermore, there's a couple of other club drugs that we would consider date rape drugs. So these are drugs that are used in clubs and parties to basically cause the person to go unconscious or to become essentially unconscious in terms of not being able to process what's going on and not being as physically active. So these are known as date rape drugs. They're central nervous system depressants. They have essentially no color. They're tasteless, so you wouldn't be able to taste it in a drink. And they are odorless, which is what makes them particularly dangerous, because a person could put one of these drugs in a drink and then nobody would really know unless they know the signs of what to look for. And when ingested with alcohol, can actually incapacitate a person completely. So very dangerous stuff. Now, ketamine specifically is a fast-acting general anesthetic. And it can bring about a reversible loss of consciousness. So the person can go unconscious for a little bit, and then over time, the consciousness will actually be regained. But this drug is marketed in the U.S. as a general anesthetic for medical and veterinary type of use. So this is a very potent drug to bring about loss of consciousness in a person. So that's all we have for you today in today's lecture about addiction and the drugs that can lead to it. So let's recap a couple of things. So today we learned about drug addiction, also known as drug dependence, and how it's characterized by a pathological desire for that drug. And it's difficult to stop doing that, even if you desire to stop using that drug. These drugs often target the brain's reward system, usually in terms of dopamine. There's a lot of things that could lead to addiction. For example, the motive, stress, the characteristic of the drug itself, genetic susceptibility, as well as how much tolerance a person has when they first take it. We talked about nicotine and smoking. We talked about the mechanism behind it. We also talked about how to treat it. We talked about alcohol and fetal alcohol syndrome. I would advise you guys to look up a little bit more about fetal alcohol syndrome, what its symptoms are, what it characterizes as, how the child is physically and what is affected. We also talked about the treatment, and then we talked about marijuana. We talked about other opiates. We talked about psychostimulants like cocaine and amphetamines. We talked about club drugs, ecstasy, and then the date rape drugs. So please review this chapter as well as all the previous chapters. Again, our main tips for you guys is to read the Brain Facts book, and anything that you have questions on in that book, highlight or write it down, and then look up for more information on that specific subject from a reputable source. Okay? We'll have more to come in the future, in the near future, and the Brain Bee is coming up soon, so we're about a month away from the 2020 Brain Bee on February 29th. So this is grind time, guys. I wish you the best. Hope you guys enjoyed this lecture, and we'll be talking very shortly, okay? Have a good one.